Doctor, could you give us an update on the latest numbers and situation here in Lebanon?
Yes, so in the past week, we have seen an unprecedented number of casualties from the consecutive attacks that occurred on Lebanon. The total number of those who were killed is around more than 700. The total number of those who have been injured is almost 5,000 individuals. The vast majority of those people are civilians, including almost around 160 women and children that have been involved. There is also a large number of them who are healthcare workers, or whether killed or whether injured. More than 20 ambulances or firefighting machines were also targeted. And yesterday, the United Nations, the UNHCR, reported that 2 of the people who work in the agency also were killed in the attacks that occurred on Monday. Monday is a singularity because it is the largest number of casualties of people who were killed in a single day, I think, since the Lebanese civil war.
And I understand there are many, many who are trapped under the rubble and missing as well?
Correct. You know, the extent of, I think, people who were killed or injured is not fully apparent yet, simply because, unfortunately, the Israelis were even targeting some of our ambulances and healthcare workforce. So we were not able yet to, remove the rubble and make sure that, everybody is, bodies are extracted.
So the bombardment is taking place in densely populated areas and where civilians are, hence the high number of civilians. You're saying the bulk of the people are civilians.
Correct.
We're also seeing many, many people fleeing the area, thousands.
Yes.
Are you able to give us some numbers as to how many?
Yeah, so yesterday on Monday, when we were trying to evacuate especially wounded to hospitals outside the areas that were targeted, we were unable because the roads were completely blocked with people. We had reports of people who were, it took them more than between 12 to 18 hours on the roads. Some of them we had incidents where people fainted. There were unconfirmed reports of patients who had heart attack or women who were pregnant who were on the brink of delivery, but these are still unconfirmed. Our estimate that there is at least in that single day more than 200,000 at least individuals moved. Sort of, there was a mass exodus from those targeted areas, and I think that this was the ultimate aim. Israel wanted to create this state of panic and terror among civilian population to provoke a mass exodus, and unfortunately this is what happened.
The foreign minister is saying that he understands almost 500,000 people are displaced now?
This is our estimation. This is still not confirmed. We have in the shelters, now it's being reported that we have almost 50,000. And we know that people are in shelters probably are only a very small portion, because most of the people who have fled, they go to homes, which is not easy for us to count. But based on these estimates, yes, I can see how the estimate is that we will reach easily that number. Just in comparison to the war in 2006, in 2006 we had over a month period of time almost 1,000 plus who were killed and 10,000 who were injured. We have reached almost half that number in 1 week only. And concerning the displaced in 2006, we had between 600,000 and 800,000 who were displaced. And our expectations, especially when we look at the extent of the areas that have been targeted, the numbers will definitely exceed the ones we saw in 2006.
I spoke to the economy minister who said, look, in the space of 24 hours, 36 hours, we've seen well over 500 deaths. You're now saying that's 700.
This is our estimate.
The estimate.
But we are still waiting for accurate numbers, but
yes.
The estimates are there.
I mean, he's saying that it could reach well over the thousands if it continues in this trajectory.
You mean in deaths?
Yes.
Well, it awaits to be seen. Already the aggression, the indiscriminate attacks by Israel are unprecedented. I mean, this is clear. Even some of the methodologies are unprecedented. I think this is the first time people see this kind of mass targeting using communication devices and so on. So yes, if there is even a further escalation, we're already at war. So this is not just an escalation. We're already at war. But if there is even further escalation, and if Israel uses these very big and strong bombs that they have to target civilian areas, as they have been doing, then yes, the numbers could reach catastrophic, even more catastrophic than what we see now.
Help us understand the state of the hospitals, because they were already overwhelmed. We've spoken to doctors who say their hospitals didn't have capacity following the pager attacks and then the walkie-talkies. We're now talking a different situation where there are, as you say, thousands who are injured and hundreds who have been killed.
So, our plan, which we had devised early from the beginning, from last October, and we have been looking at what's happening in Gaza and how, there was mass casualties, there were targeting of civilian areas or healthcare institutions, and we have been adjusting our plans accordingly. So what we have done is we've prepared our hospitals, all our hospitals in all areas in Lebanon, to receive mass casualties and what they should do. But more importantly, we have created a very strong coordination between different hospitals, between ambulance services, to allow us to quickly absorb the large number of patients within all of the system. So instead of all of the patients going to a single area where the targeting happened, we were able to channel those patients into those different systems, and we were even transferring patients to hospitals in north of Lebanon, areas where were not involved in the targeting. And I think this helped the health system really absorb the shock of the indiscriminate attacks that we saw. Now, the question is, for how long can we keep up with this barrage of attacks, especially, as I said, that even when Israel claims that it is giving warning to people, it's giving warning in almost in half an hour before they start bombing and attacking. So these are not serious kind of efforts to really protect civilians, not at all. This is just window dressing, so to speak. And if indeed we see a continuation in that route, then yes, I can see how the health system is overwhelmed. Actually, I don't think any health system can be prepared to this level of carnage.
What do you need right now? What does the health ministry, the health facilities, the hospitals in Lebanon need?
I think what we need is a ceasefire in Gaza that goes from Gaza to Lebanon. I think that it's very clear. This is something that we should not accept, but prepare for. I think the international community has a duty to implement international humanitarian laws. It has a duty to protect civilians. It has a duty to exert pressure on Israel to stop what it is doing. I think that the international community cannot stand by and allow the actions that are being perpetrated by Israel on Lebanon. And we should not accept this, but prepare better. So I think that this is, let's be very clear, the answer of what's happening is not better preparation of the health system. The answer of what's happening is exerting pressure on Israel to stop what it's doing and go the route of a diplomatic solution or whatever there goes. Now, concerning the health system, because we know that Israel turns its back on the international community, even it turns its back on its backers. We have to increase our level of preparedness. That's why we have elevated our level of inventory to 4 months of medications and medical supplies. Countries that are supportive of Lebanon are sending us also medications, medical supplies. We've received from, today I was at the airport receiving medications, medical supplies from Turkey. We've also received from Egypt, from Jordan, from Iraq, and there are other countries that have expressed their intent and that help is on the way. Concerning healthcare workforce, first we need our healthcare workforce not to be targeted. As I said, up till now we have lost almost 28 healthcare workers that have been killed by indiscriminate attacks by Israel. And the second, we are working with our different orders, the order of physician, the order of nurses, to make sure that we have good distribution of this workforce across our hospitals and to be able to provide services. Now here as well, we have had contact from several international organizations that are very much interested in coming and supporting us, such as the International Community of the Red Cross, such as Médecins Sans Frontières, such as also from the UK, some of the EMTs, the Emergency Medical Trauma teams, that will be coming and helping us expand our trauma centers to be able to receive and manage additional number of casualties.
Doctor, do you think that Hezbollah also needs to be reined in? Because that is what Israel is saying, that they have had to deal with almost a year of rockets and their citizens being forced out of the border areas.
I think that everybody needs to be reined in, including Hezbollah. But I think that Hezbollah was very clear. And it said that if there is a ceasefire in Gaza, that they will cease their activities. And I think that if this is their claim, let's remove the excuse that they have, and that is that the carnage in Gaza is continuing. Let's start with a ceasefire and then take it from there. And I think this is what everybody has been calling for, including the Prime Minister in the UK. I heard him yesterday during the Labour conference mention a ceasefire in Gaza. I think this is something that I think the international community, everyone except one particular party, who is clearly not interested in any ceasefire. It's only interested for further escalation in its actions. And unfortunately, if that particular party is not reined in, it will cause havoc not only in Lebanon, but in the region. I think this is what everybody seems to agree is the right way of allowing us to go out of the situation with a minimum of casualties to innocent lives.
But given you're saying that the death toll now at this point is about 700, that carnage, are you worried that Hezbollah linking the situation here in Lebanon to Gaza will mean more devastation for Lebanon?
So, we in Lebanon have been used to, intrusions and attacks by Israel. These were there even before Gaza. These were there, even as we speak, there are areas in Lebanon that are occupied by Israel. And I don't think that Israel needs any excuses to attack Lebanon. We have seen this even before Gaza, as I said, whether through their intrusions by their warplanes or others and so on. But in my opinion, what is extremely important to remove the excuse of any non-state actor, whether that non-state actor is in Lebanon or in Syria or in Iraq or in Yemen or anywhere else. We all agree the starting point is a ceasefire in Gaza, and I think that this will allow us the right way to move in and de-escalate the whole situation.
Doctor, thank you so much for your time.